Hi everyone, welcome to this week's CCASA Public Policy Podcast. Just wanted to give a few quick updates of what we've been working on and ways that we're really going to look for help from you all. So the legislative session has started a little bit slow, I feel like. There have been some bills kind of trickling in that we've been taking a closer look at, and also a lot of bills that we know are still to come that we're waiting for. Two this week that I've spent a lot of time talking with stakeholders about and reading and reviewing and discussing potential amendments I wanted to just briefly discuss today. One is House Bill 1020, and it's concerning forensic evidence. Essentially what happens to rape kits and how they're tested, how they're prioritized for testing. So that is a bill that is being sponsored by Representative McNulty. So we've spent the week talking to a lot of stakeholders, different community-based programs, sexual assault nurse examiners, folks in law enforcement, to get a sense of what this bill will do, how we think this bill will help, and how we can really make sure that this bill has a great system set up for consent for victims, so that victims are able to consent to having their evidence collected, having their evidence tested, but also that there's a process in which victims can consent or can give withdrawal of consent if they decide that they do not want that evidence tested. So as folks know, it's a really complicated issue. If you've seen any of the national attention on addressing the rape kit backlog, it's a very complex issue and there's not easy answers, but we're taking a really close look at this bill and hoping that we can contribute to the process and make sure that it's the most victim-centered bill possible. We've also been taking a look at House Bill 1081, which is taking a look at comprehensive human sexuality education, or comp sex ed, in Colorado public schools, and our interest in that is really just making sure that sexual assault and teen dating violence are considered components of comprehensive sex education, and that students are getting evidence-based, accurate, culturally sensitive content area around both sex assault and teen dating violence, and that education is done in a manner that really utilizes the expertise of rape crisis centers and victim advocates around our state. So that's something we're actively working on as well. Our bill has still not been introduced, but it will be the Sexual Assault Victim Emergency Fund that will help pay for medical costs that are incurred when a victim receives a medical forensic exam. We're anticipating that bill to be introduced very soon, hopefully sometime next week. And I will say that what we're really going to be looking for in terms of getting this bill passed is hearing from survivors. So if you're a survivor, or if you work with a survivor that maybe did not access medical care following a sexual assault because of those prohibitive costs, or being afraid about those medical bills that would come in, or if you're a survivor or work with a survivor who maybe did go to the hospital following a sexual assault and then really had to grapple with those burdensome bills and had some real challenges in paying those hospital bills, those are the types of cases we really need to talk to folks with. What we're advocating for is that we can actually get some funding out of the general fund to help victims pay for those costs. So if you've been affected by this issue, please feel free to contact me as soon as possible. Advocacy@ccasa.org or 303-839-9999. If you've never been involved with public policy work and have no idea what that means to even be involved with a bill, no problem at all. I'm happy to discuss it with you and talk about different options for making sure that your voice is heard. We'll also be working with CCDV a little bit later on in the session in terms of ensuring that sex assault victims have access to civil protection orders. So again, if you're a survivor, or if you've worked with a survivor who is needed to access a civil protection order following a sexual assault and maybe were denied that request, I would really like to talk with you, because these are the issues that we're trying to improve in our state. So that's just a brief summary of what we've been working on. I just want to remind folks to please check out our website, ccasa.org. If you click on the public policy link, I'll be providing weekly updates there with a little chart of what we're monitoring, what we're actively working on. We'll also be updating our social networking sites with more urgent information as well. So thanks again for tuning in, and thanks so much for getting involved.